Hi, my name is Dr. Meaghan Delaney, and I'm a reproductive endocrinologist and infertility specialist at Boston IVF. I see patients mostly out of the Springfield office, and I know that going through fertility treatments can be really stressful and challenging. So we just wanted to go over a few points that can kind of help you get through this difficult time. When you start treatment or testing, it's important to kind of prepare yourself and make sure that you're the most successful you can be. And there's a lot of ways that you can start doing that just at home on your own. Some of them are just like preparing your mind and body to kind of go through this process. Um, it's really important to educate yourself, to be empowered to ask questions that are important to you. We at Boston IVF can offer you a lot of resources in the form of videos that talk about different treatments, fertility sites that talk about different ways that you can administer medications. They have the instructional videos that you can go over with that. So there's a lot of resources that we can provide for you and that are out there on the internet. Some of them are not so good, so ask us the right ones. And it can help you kind of be more comfortable going through this process. It's also hard to go through this alone. So if you have a partner, if you have close friends, family that you're comfortable sharing what you're going to be going through, sometimes it's really helpful just to have someone to talk to about things. At Boston IVF, we also have care teams that can offer support as well through counseling and other mind and body experiences. So please ask if that's something that you're interested in. There's also online support groups. There's in-person support groups that are likely local in your town or a neighboring town. So ask us for those resources as well. Then preparing your body. There's a lot of things that you can do to kind of get yourself ready for this process, and you can take control of a lot of things that can make better outcomes. So just basically taking a multivitamin or prenatal vitamin that has at least 800 micrograms of folic acid is often really helpful to get your body ready for pregnancy. In addition, there's some things that are not so helpful for fertility outcomes, like smoking and increased alcohol use and lots of caffeine. So those are some things that you can kind of modify to help with your fertility outcomes. Typically, we recommend you drink less than 250 milligrams of caffeine a day, but certainly talk to your care team about their further recommendations. In addition, for alcohol, it's recommended to have 5 or less drinks a week for fertility, improved fertility outcomes. There's a lot of people ask if there's a particular diet that you can follow that will improve like egg quality or sperm quality or just general pregnancy outcomes. And there really isn't a particular one that's recommended, but we do generally say to kind of avoid as much processed foods as possible. So meats and vegetables. There are some studies that demonstrate that maybe the Mediterranean diet is maybe a little more beneficial. So that's another thing that you could potentially help to follow what may be the best foods to eat. Treatment in itself can be stressful. There's a lot of visits, there's a lot of ultrasounds and blood work, and it's important to have kind of a game plan to get ready for your days when you're going through your fertility cycles. Make sure you know what time your appointment is. Maybe give yourself a little bit of extra time to get there if there's traffic and parking issues. Make sure you have someone to drive you if you are going to be under anesthesia. And certainly ask your care team if that's something that's needed for other procedures. You're going to meet a lot of people that day. You're going to have lots of paperwork to sign and IVs and other things that kind of are being done. So it can be a little bit stressful and you may forget some of your questions. So it might be helpful to write them down on paper, put them in your phone so that you make sure that you ask your care team the questions and you get them answered before you have your procedure. When going through fertility treatments, we always hope for the best. And we definitely try to give you information on every step of the way. Sometimes the information is not what's expected. And we answer your questions, we make sure you're well informed, but just know that there can be curves in the road that are just not something that we expect. And that happens, it's normal. We're here to answer any questions and help you through those difficult times. IVF is a common treatment that we can offer. And that in itself can be a stressful time. When you go through an IVF cycle, you're having lots of ultrasounds and blood work. And then the day of the egg retrieval is often, stressful because you don't know what to expect, but there's lots of videos, there's lots of information that our team can offer you. So ask your questions all the time whenever you have any. But the night before the egg retrieval can be particularly stressful because, it's a procedure and you're going to have anesthesia. But try your best to get good sleep the night before so you feel pretty rested the day of. Your care team is going to send you a lot of information about instructions for that day. So make sure you read through that several times. And if you have questions about any of it, just let your team know. One of the most important things for that day is not to eat or drink anything from the night before your procedure to the day of. If you come to the surgery center and you've had anything to eat or drink, we may not be able to do your procedure or give you anesthesia. Sometimes you have medications that you need to take despite not being able to eat or drink. Your care team will let you know the day before what medications that you need to take with a small sip of water. But certainly if you have any questions about what medications to take, please talk to your care team. You are going to come to the surgery center and they're going to have you change into a gown and a nice warm robe and some cozy socks, nice warm blankets. But make sure that you pack a bag with anything that is important and that you need for that day. It might be medications that you need to take. It might be some paperwork that you need to deliver. Some people bring a change of clothes. Some people have a cool pair of socks that are their lucky socks and they can wear them that day. So anything that's going to make you more comfortable, feel free to bring that with you. Your transportation to and from the procedure is very important. You are going to be under conscious sedation. So that means you're going to be getting medication in the IV. It's going to make you sleepy, but you're going to be breathing on your own, just totally asleep during the procedure. You'll wake up relatively quickly, but it's not safe for you to drive or make any important decisions that day. So please be sure that you have a trusted person with you to drive you to and from the procedure. Traffic around Boston can be quite challenging at times. So make sure that you look ahead at maybe Google Maps, plan for a little bit extra cushion time, because with an IVF egg retrieval, timing is pretty important. So it's pretty critical that you arrive at the time that is specified by your team. So make sure that you leave a little time for weather issues and traffic issues as well. The second half of the IVF process is the embryo transfer. The embryo transfer differs a bit from the egg retrieval in that you do not need anesthesia for this procedure. So you're able to drive yourself that day if needed. In addition, you can eat and drink before that procedure because you're not going to have anesthesia. And the only real difference is that you do need a full bladder. A full bladder is pretty critical for allowing us to see your uterine lining and also place the embryo in the correct place. It can be a little bit uncomfortable to have a full bladder, so please inform your team if you're very uncomfortable. Sometimes you can let a little bit out. In addition, your team will give you information on when to empty your bladder and then when to start filling it again before the procedure. So hopefully this was a good amount of information for you to get a little sense as to what to expect for the IVF process. Definitely your team is here to help in any way that you need. And so please do not hesitate to reach out for anything. You may think it's a silly question, but it really isn't. So please just let us know. We all wish you the best of luck.